TomoTherapy is a radiation machine to treat cancer. So the question really is twofold. The first question is, what kind of radiation distribution is optimal given the situation, where the tumor is located, how much is needed for that kind of tumor, right? The second question is, how does TomoTherapy take that radiation plan and actually make it occur? With TomoTherapy, the radiation comes all around, and so it distributes everything. And it turns out when you distribute things like that, you get much better dose distributions. In a sense, what you can do is you can minimize a lot of the dose to the healthy tissue a lot better because of that kind of radiation treatment. Some people will come in and get their treatment done in a few days, right? Some people will come in and get their treatment done in weeks, 5, 6, 7 weeks. And so the question is, which one is better, right? Well, it's clearly different. And what it comes down to is I have to find a way to minimize that damage to the healthy tissue, maximize the damage to the tumor. Now here's the crazy thing, is that the alpha betas are different for the different tissues. And so what happens is, depending on the alpha betas of the tumor versus the surrounding tissue, it can make more sense to distribute that radiation throughout several weeks. I get more bang for the buck that way, if you will. Or, depending on the alpha beta, if in some cases, like prostate is a great example, the roles of the alpha beta relative values are flipped. So it actually makes more sense in that case to reduce it and treat in 1 fraction, 2 fractions, 3 fractions in a theoretical sense. So basically there's no one answer to that, but people are trying a lot of different regimens, and they're using this kind of modeling to come up with kind of the best bang for the buck. One place that TomoTherapy shines is IMRT type plans where you have a larger tumor and you're maybe not sure exactly where the border is of that tumor. And this happens a lot where you're looking, you're saying, well, I know it's in this region, I can see from the CT or MRI, this is generally the area, but I expect there's also some disease further out, right? So if I really want to treat this properly, I'm going to have to treat a much larger volume. And TomoTherapy is excellent for that in terms of its imaging, in terms of its actual ability to distribute the dose nicely for that. So generally speaking, anything which requires, where there's an uncertainty of exactly where you need to place the radiation, but in that case you have very, very strict constraints of how you deliver it.